जी अस्सलाम वालेकुम स्टूडेंट्स, आवाज़ आ रही? जी चैट में बता दिए, आवाज़ आ रही? ओके सर।
कितने ऑन किए हैं? कितने ऑन किए? हेलो, नहीं, अच्छा वो आपने म्यूट कर दिए। हेलो, अनम्यूट कितने? ये वाले जो नज़र आ रहे हैं, ये तो म्यूटेड है ना? हाँ, नहीं नहीं, वो फिर आखिर में जब क्वेश्चंस के लिए होगा तो फिर ठीक है, चलो ठीक। अस्सलाम वालेकुम, आई एम डॉक्टर सलमान फ्रॉम मेडिसिन डिपार्टमेंट। So, today the topic for discussion is the renovascular disease. I hope you will be familiar with the anatomy and physiology of uh, renal vascular system. So mainly the blood supply of kidney is via renal artery, while venous drainage is via renal vein. The renal artery basically divides into small arterioles after and arterioles further subdivide into capillaries. This capillary network is called glomerulus, and eventually the capillaries join together to form venules, which finally drain into renal vein. And renal vein carries venous return from kidney, and finally drains. So, what is renovascular disease? Basically, renovascular disease is the disease of arteries of the kidney, which can lead to high blood pressure and or kidney failure. So, what are the types of renovascular diseases? Renovascular disease is mainly of two types. That is atherosclerotic renal artery stenosis, and the other one is fibromuscular dysplasia. Atherosclerosis is better known as hardening of the arteries. It is common disease. Atherosclerosis is the cause of 9 out of 10 renovascular diseases. And approximately 90% of the renovascular disease involves renal artery stenosis. And this atherosclerotic renal artery stenosis can involve large as well as small branches of the renal artery. Patients with diabetes, aortoiliac occlusive disease, coronary artery disease, or other forms of high blood pressure are at risk of developing renal atherosclerotic renal artery stenosis. The main risk factors for renal artery stenosis are high blood pressure, high cholesterol, older age, smoking, diabetes, heavy alcohol use, or other drug abuse. If the patient is having renal artery stenosis, that is of atherosclerotic variety, there may be an ongoing narrowing of the renal artery that uh, can even lead to end-stage renal disease and eventually death of the patient if this is not properly addressed timely by medical or surgical intervention appropriately or renal transplant. The other variety of renovascular disease that is relatively less common is fibromuscular dysplasia. This is a group of vascular diseases that affect the lining of the renal artery, and as the atherosclerotic renal artery stenosis is seen in 90% of renovascular diseases, but the fibromuscular dysplasia is seen in approximately 10% of atherosclerotic renal artery stenosis cases. And this is most commonly seen in women and young people, young to middle-aged people with age ranging between 25 and 50 years. And as opposed to atherosclerotic renal artery stenosis, in which large as well as small branches of the renal artery may be involved. In case of fibromuscular dysplasia, the main renal artery and its branches may be involved. So, in atherosclerotic renal artery stenosis, large as well as small branches of the renal artery may be involved. But in case of fibromuscular dysplasia, main renal artery and its branches are usually involved. And the fibromuscular dysplasia radiologically appears as beads in the arteries. That is the typical beading appearance of the arteries on imaging tests, that is the angiograms, and as opposed to renal artery stenosis of atherosclerotic variety, in which total stenosis of the renal artery may be seen. In case of fibromuscular dysplasia, total artery blockage is less common. The cause of fibromuscular dysplasia is exactly not known, although some experts think that genetics play a role. Smoking, hormones, and disorders of the blood supply to the renal artery may also play a role. So, what are the symptoms which patient can experience with the renovascular disease? The patient may present with high blood pressure, often of extreme severity. Sometimes it is hard to tell if hypertension is a form of renal artery problem or something else. Is from renal artery stenosis or something else. Important signs of renal vascular disease involve high blood pressure, particularly at an early age. And the blood pressure usually is extremely high and is very difficult to control. Then there is kidney dysfunction, narrowing of arteries throughout the body, and signs of malignant hypertension. Patient may present with headache, confusion, nausea, vision changes, and lightheadedness as well. So, how can renovascular disease can be diagnosed? The diagnosis of renovascular disease uh, involves, first of all, high index of clinical suspicion, journal physical examination with routine blood and urine testing. That involves fasting lipid profile, renal function tests that are serum urea creatinine, and urine tests for any proteinuria or hematuria. So, in addition to the basic blood and urine testing, the most specific diagnostic testing as far as renovascular disease is concerned are the imaging studies. And that may involve a Doppler ultrasound of renal arteries, a renal angiogram to see the renal artery caliber, and a 3D CT or renal angiogram to see the cause of renal artery stenosis, and also to look for extent of the disease. So the diagnostic modalities involve Doppler ultrasound of renal arteries, renal angiogram, and a 3D CT renal angiogram to further identify cause of the renal artery stenosis and the extent of the disease. So once the diagnosis of renovascular disease is established, what are the treatment options that can be used timely before end-stage renal failure? And the goal of treatment is to control blood pressure and prevent renal failure. These are the main major goals of treatment in renovascular disease. First of all, to control blood pressure, and secondly, to prevent renal failure. So, amongst the treatment options, there are general measures and specific measures. Amongst the general measures, uh, there are lifestyle as well as dietary modifications. Amongst the specific measures, there are medical as well as surgical therapies. So, amongst lifestyle changes, if the patient is smoker, he should quit smoking. Patient should do a regular exercise, and modify dietary habits as well. Patient should be more on fruits and vegetables and avoid saturated fats. Rather, the patient should choose unsaturated fatty acids. Particularly in case of atherosclerotic renal artery stenosis. and control high cholesterol levels. Though amongst the specific measures, medical therapy, uh, the medical therapy may involve the use of antiplatelets like aspirin, then the lipid lowering agents if the patient is having hypercholesterolemia, and drugs for other conditions, particularly antihypertensive or blood pressure lowering drugs. But in case of renal artery stenosis, the major thing while using antihypertensive medication is to avoid angiotensin receptor antagonists, as they may cause a certain renal damage by reducing renal blood flow that is primarily damaged by renal artery stenosis. So in this case, one should recall renin-angiotensin-aldosterone system that activates in case of systemic hypotension and renal hypoperfusion. But as in case of renal artery stenosis, uh, the body compensatory mechanism reads as if the patient is suffering from systemic hypotension. That is why the renal perfusion is low, and renal angiotensin aldosterone system in turn activates and tries to improve systemic blood pressure so that the renal perfusion pressure should be improved. But in case of renal stenosis, artery stenosis, this should not be the case. And ARBs that block renin-angiotensin-aldosterone system, they may decrease systemic blood pressure, and the renal perfusion pressure in turn may be further decreased, and that can be hazardous for the kidneys. So angiotensin receptor blocker drugs should be avoided uh, in case of renal artery stenosis, and other antihypertensive agents may be used. So the medical measures involved antiplatelets like aspirin, lipid-lowering agents if patient is having hypercholesterolemia, and drugs for other conditions such as antihypertensive agents apart from angiotensin receptor blockers. So this is the medical management. If the patient is not relieved by medical management, surgical procedures may be adopted, and amongst the surgical procedures, uh, there are endovascular procedures that are used to remove blocks in the kidney arteries, to restore renal blood flow, restore renal function and to control the high blood pressure. So the first surgical modality may involve endovascular procedures to remove blocks in the kidneys. The other surgical procedure may involve a balloon angioplasty of the stenosed artery. It is done inside the blood vessel with a tiny balloon on the end of the small flexible tube called a catheter. In atherosclerotic disease, a renal artery stent may also be done. So the other surgical modality involves balloon angioplasty, and stenting may also be considered. The third surgical modality, if the upper two modalities fail, may involve surgical revascularization, surgery renew blood to renew blood flow. For example, aortorenal bypass grafts or extra anatomic bypass procedure may be adopted to restore blood flow through the stenosed vessel. And in case the above three procedures fail, there is still a complex procedure available called bench surgery. This involves a kidney transplant with the reconstruction of the renal vessel. But this is very rare procedure, and this is not commonly done. And this procedure may be considered in few specialized centers in case the medical as well as the other surgical modalities fail. So after treatment of the patient with renal artery stenosis, what could be the post-treatment outcome of the disease? After treatment, the blood pressure of the patient should be improved, and kidney function should be better, and a careful follow-up treatment should be considered. The disease has been seen to come back after 3 years in approximately 15% of the people with mural dysplasia after treatment. So this should be taken into account because 3 years post-transplant, the disease may recur in 15% of patients with mural dysplasia. And atherosclerotic renal artery stenosis post-treatment, approximately 44% of the patients still experience difficulty in controlling their blood pressure and renal failure as well. So this is a very difficult disease to be treated and controlled as suggested by this post-treatment data. And according to the studies conducted, 3 years post-treatment, the disease may recur in 15% of people, and approximately 44% of the people with the atherosclerotic renal artery stenosis can experience difficulty in controlling their blood pressure and may experience renal failure as well. So this is the brief overview of renovascular disease. First, I told you brief anatomy of the renal vasculature. Then renovascular disease. Two major varieties of renovascular disease, that is the atherosclerotic renal artery stenosis, and the other one is fibrodysplasia of the renal artery. The most common one amongst the two varieties is atherosclerotic renal artery stenosis, occurring in approximately 90% of the individuals, particularly elderly patients and patients with comorbids, and the fibrodysplasia occurring in approximately 10% of the patients, mostly young patients. And then I discussed important clinical features, symptoms, and signs of the renovascular disease. Then diagnosis of renovascular disease, that is the basic blood and urine testing, and importantly the imaging studies. It is the Doppler ultrasonographic study of the renal artery, renal angiogram, 3D renal angiogram. Then I considered briefly the treatment options, that are journal measures that involve lifestyle modifications and dietary modifications, and specific measures involving medical as well as surgical therapies. Amongst the medical therapies, uh, antiplatelets such as aspirin, lipid-lowering agents, and antihypertensive drugs, apart from angiotensin receptor blockers. Amongst the surgical procedures, renal artery angioplasty, and the bypass procedures. Then the bench procedure involving renal transplant with reconstruction of the renal artery. And last but not the least, post-transplant follow of the patient. The disease, as the studies have revealed, that may recur in approximately 15% of patients 3 years post-treatment, and approximately 44% of the patients with atherosclerotic renal artery stenosis may experience difficulty in controlling their blood pressure and renal failure as well. Excuse me. क्वेश्चंस के लिए कर Thank you very much for questions. Hello. Any question, please? Any question, please? ये क्वेश्चन वो कर दिए क्वेश्चंस के लिए यहाँ पे शो हो रहा है, इधर शो हो रहा है। ये कुछ तो वो मैंने क्वेश्चंस के लिए मैं कहा है, ठीक है वो मैंने कहा। ये सारे एनी क्वेश्चन, any question regarding the lecture renovascular disease? Any question please? Thank you very much. बंद करें आप।